The 204S is a sickle scaler used in the posterior sextants of the mouth only. This periodontal instrument is used to remove medium to large size calculus from the crowns of teeth. This should never be used on the roots or subgingivally. The way this instrument is designed, it has a pointed tip, is triangular in cross section, and it has two working ends that are mirror ends of each other. Each working end has two cutting edges, giving the instrument a total of 4 cutting edges. The face of the scaler is perpendicular, so it is at a 90-degree angle to the lower terminal shank. The terminal shank is complex, so to better access the posterior teeth. We use the terminal shank as a visual clue to determine the correct working end of the instrument. The terminal shank should be parallel with the long axis of the tooth. This is the correct way, and this is the incorrect way. When using the instrument, a modified pen grasp should always be used, with a C shape created between your thumb and index finger. To insert this instrument, you need to make sure you have the correct working end by using the terminal shank to guide you. Insert at the Get Ready zone, which is in the middle third of the crown, just 1 stroke before the line angle. The tip of your instrument should be facing in the direction you are going. With the instrument, we start with the distal of the tooth, so the tip should be facing the distal. With the tip third adapted to the tooth, distal rock with no lateral pressure to explore until the terminal shank is parallel or 90 degrees with the long axis of the tooth. You should see blanching of the tissue from the back of the scaler touching the free gingival margin. Then you will tip the terminal shank to 70 to 80 degrees towards the tooth in order to do your scaling stroke. You will activate lateral pressure using your thumb and index finger to scale. The distal and mesial line angles of the teeth will be a vertical stroke. Adapt your instrument at the height of the stroke so not to harm the tissue. Rest and repeat stroke until your tip has reached under the contact area.
Explore, tilt, scale, explore, tilt, scale.
When you've reached the contact area, back your tip out and adjust it toward the tooth so that it's now facing in the mesial direction on the tooth. Start at 1 stroke before the distal line angle in the middle of the tooth to begin your oblique stroke. Still using the same distal rock to explore and mesial rock to scale, the stroke should be kept small so you don't fall off the face of the scaler. Continue to work across the facial or lingual surface, adapting the tip at the height of each stroke by rolling the handle. Once at the mesial line angle, you want to explore at a closed angle, so a big distal rock is used to explore, making the terminal shank less than 45 degrees on the tooth. Then you're going to scale at 70 to 80 degrees using a little mesial rock, making sure the terminal shank does not go past parallel. Make sure to roll the instrument to maintain adaptation at the line angle. You may have to pivot on your fulcrum to maintain this adaptation. Continue the vertical strokes until the tip of the instrument is under the contact area. Once at the contact area, you're going to back out with the tip being the last thing to exit.
To do the mandibular tooth, you're going to start at your Get Ready zone, which is the middle third of the crown, just 1 stroke before the line angle. Make sure that the tip of your instrument is facing in the direction you are going. You're going to do a distal rock with no lateral pressure to explore until the terminal shank is parallel with the long axis of the tooth. Then you will tip the terminal shank 70 to 80 degrees towards the tooth and activate your lateral pressure in order to scale. At the height of your stroke, that is where you're going to adapt your instrument, and you're going to continue doing these strokes until under the contact area. Once you are at the contact area, you're going to back out the tip and adjust towards the tooth to face in the mesial direction. Start 1 stroke before the distal line angle and do a distal rock to explore and a mesial rock to scale. These are going to be your oblique strokes. You're going to maintain your adaptation at the height of each stroke. Once you get to the mesial line angle, you're going to do a big distal rock to explore, which is less than 45 degrees, and use a little mesial rock to scale at 70 to 80 degrees. You're going to make sure that the terminal shank does not go past parallel. Roll your instrument to maintain adaptation at the line angle. Once at the contact area, back the handle out with the tip being the last to exit.